Hi everybody, Dr. Carrie Gans here again with a Facebook Live presentation, and sitting here in my office, no patients yet, so I figured I'd spend some time with people and maybe give you guys some information. The topic for today is minimal dentistry, or minimized dentistry, whatever you want to call it. And one of the things we know as dentists know that if we catch decay early, and we call it incipient decay, early decay, whatever you want to call it. If we catch it really early, it's much easier to take care of, less expensive, less time consuming, very often without anesthesia. So that what we look for during your exams, which is really why it's so important that you see your dentist more than twice a year. That's an old adage from, I guess, a toothpaste company years ago. But we believe that patients should see us at least 4 times a year to make sure if anything is starting, we catch it real early. And there are other reasons to see your dentist 4 times a year as well, from a periodontal or gum standpoint. But from a decay, as far as decay goes, if we can catch these things early, it really helps. One of the tools we use in our office is something called diagnodent. Now, why do we use this? You see, if you've been to the dentist recently, you probably took an instrument called an explorer. It looks like a little hook, ugly, evil-looking instrument, but that's what it's called, an explorer. And we poke onto the surface of teeth to see if it catches, if we find anything that's soft. And very often it's on the biting surface of your tooth, where the lobes of your tooth, as they're formed, don't fuse totally, and you get these little cracks in your teeth. And if we can poke the explorer in, we know that that's potentially decay, and we usually go and try to treat that. Now, the unfortunate part is some of those cracks in the teeth, those little defects, are narrower than the width of the explorer. It seems odd. These explorers are very tiny, but the truth is that very often, like an iceberg, there's a little tiny hole in the biting surface of the tooth, but if you go below that hole, the decay can be substantial. Sometimes not even seen on an x-ray until it's much deeper, and then it requires anesthesia, etc. So the diagnodent, instead of using a metal instrument, uses a laser, a red laser. It's painless, non-invasive, can't hurt you. You don't feel anything. But it uses this red laser to go through those little cracks, those little crevices in the teeth, to see if there's decay. And it registers a number and a sound. We know that if the number, and the number is a meaningless number, other than the fact that anything over 10 or 15 signifies that there's decay present. And you can hear an audible sound at that level. So we usually give the patient the device to hold. It's real tiny. And as we go around the mouth, if we hear an audible sound, we know that there's something going on there. And usually these are very easily treated, and we can go ahead and treat them without anesthesia, very inexpensively compared to what the cost would be if this decay proceeds to getting larger. And once again, much like an iceberg, this decay grows beneath the surface of the tooth, so we very often don't see it until it's on an x-ray. And then, typically these are much more difficult to treat. So the diagnodent gives us great data. And once again, in dentistry, we need data. X-rays give us data. There's a bite analysis tool called TechScan that when people come in with bite problems gives us real computerized data, so we can really see and understand what we're talking about. Diagnodent is another great tool that we now have that allows us to go ahead and find decay when it's real small. We can treat it real easy, very inexpensively, and go ahead and get you back, go back to your business and not have to spend a lot of time and money taking care of your teeth. Catching decay early is really key. So if you come to the office and we use this little tool and we hear a sound or see a number that's anywhere over 15, we know there's something going on. And if it gets into the 20s, 25s, and 30s, we know that there's significant decay under there that may not have been seen on an x-ray. And that's important to understand. We do take x-rays. X-rays are very valuable tools, but they don't catch everything. And diagnodent is just another tool that we have to help our patients avoid significant dental cost and any kind of dental pain and infection. So once again, diagnodent. If you're interested, if you happen to live here on Long Island and you're looking for a dentist, give us a call. We're right here right across from Roosevelt Field, actually right across from the new Neiman Marcus. You can always get us at 516-741-1230. If you don't live on Long Island and you live elsewhere, you should ask your dentist if they have that kind of tool. I believe it's invaluable. It's one of those tools that I think every dentist should have. I have no financial, I don't own the company. I wish I did. It's made by a big company, but every dentist should be looking at this as an invaluable tool to help their patients. Any questions, once again, you can always reach me at 516-741-1230. Please share this video so that it can help others. So they at least, when you go to your dentist, you can ask questions and get the information you need to keep your teeth for the rest of your life. If there are no comments, then we're going to go ahead and close this, because it really was just meant to talk about finding disease early. And I don't care where it is in your body, if you catch it early, it's easy to treat. Wait until it's bigger, it's always more difficult. Once again, have a great day. My name is Dr. Cary Gans here in Garden City, New York. Any questions, give me a buzz. Always interested in chatting, and we'll see you again at another Facebook Live.